Clinical depression manifests as more than a low mood. It is a state of cognitive inflexibility. Patients frequently describe a sense of being trapped by pessimism and rigid, repeating thought patterns that become their psychological reality. For decades, SSRIs have been the primary tool for intervention. Yet even the most common antidepressants show modest efficacy, often accompanied by side effects and significant rates of relapse. This creates the challenge of treatment-resistant depression, where the standard pharmacopoeia fails to provide relief despite multiple attempts with different medications. Long-term recovery relies on physically interrupting the cyclical loops that keep the mind trapped, moving the focus from temporary emotional shifts to structural change. Neuroimaging shows that this feeling of being stuck corresponds to the actual physical state of the brain. This is the default mode network, or DMN. It handles introspection and self-reflection. Normally, it's part of a larger conversation, but in a depressed brain, the DMN becomes hyper-segregated, running in a closed loop, cut off from critical modules like the executive or salience networks. This isolation led researchers to a radical question. Could psilocybin, the active compound in magic mushrooms, physically force these segregated networks to open up and interact? If the architecture of depression is defined by isolated networks, science requires a mechanism capable of restoring global communication across the brain. At Imperial College London, a clinical research team began a series of investigations to map this process. Their first trial was an open-label study, administering psilocybin to 16 patients with severe treatment-resistant depression. They followed this with a double-blind, randomized controlled trial. This time, they compared psilocybin directly against escitalopram, a common SSRI, in a group of 43 patients. This setup provided a rigorous physiological comparison between a classic psychedelic and the established standard of psychiatric care. Researchers measured network modularity, how segregated brain networks are. Initially, both groups showed isolated clusters. After psilocybin, modularity dropped. The default mode network integrated with the executive and salience networks, creating global communication. Escitalopram scans showed no change, remaining rigidly segregated. The data revealed a direct correlation. Patients showing the most significant increase in network integration also experienced the most sustained symptom relief. Psilocybin's efficacy appears tied to this unique ability to reorganize the brain's communication pathways, a structural shift that traditional antidepressants did not produce. Researchers describe this as creating a flatter energy landscape. Imagine a terrain of deep grooves that rapidly smooths out into an open plain. In this flatter landscape, the brain can visit a broader range of states. For the patient, this means they are no longer held by the gravitational pull of repetitive, pessimistic thoughts. Psilocybin appears to restructure the mind's architecture, moving beyond symptom suppression to physically reorganize the brain's functional connections. Recovery is often a matter of biological flexibility. By increasing the brain's plasticity, psilocybin allows the nervous system to move past the rigid boundaries of the disorder. It is important to remember that these findings come from a strictly clinical setting. This research is a study of medical intervention, not an endorsement of unsupervised use. In these trials, the drug was part of a larger therapeutic protocol involving professional psychological support. Widespread clinical use still depends on the results of larger Phase 3 trials. Our understanding of the brain is shifting from chemical balances to network dynamics. To see where this research goes next, subscribe to our channel and share this video with anyone interested in the future of neuroscience.